listening to the Pharmacy Podcast Network.
Ever since COVID, what we know to be the norm is rapidly changing. In order to adapt to this, your business must adjust and transform accordingly. For pharmacies, unlocking the profession's potential to improve patient care is where this opportunity lies. Today's product-focused role of the pharmacist calls for the industry to move toward clinical services. The focus will be on prevention over treatment, and care will happen in the home or community. As accessible and trusted healthcare personnel, pharmacists can play a big role. Happier at Home harnesses this opportunity by showing the benefits of expanding your pharmacy into home care services and how this is a recipe for success. Innovation and growth will help community pharmacies to continue to exist and thrive in the future.
Hey, I am so excited to be a part of this. This is the Happier at Home PRN podcast, a collaboration with Debbie Marcello and the Pharmacy Podcast Network. Reason why I'm so excited is because I see dominoes starting to fall based on the introduction of home care services as a new revenue source, but more importantly, the care that our community pharmacies are now extending to our communities and people that sometimes can't get out of their home and they don't have anyone else taking care of them. So there is a servant leader's heart that Debbie has. That's why I've really enjoyed working with her. Debbie, thank you so much for letting me be a part of this.
Thank you so much. And thanks for that introduction. I'm very happy to be here. And more importantly, so happy to be becoming one of those resources for all of your listeners, for all the pharmacy owners out there, and really helping them to embrace and expand into using their community-based model and expanding into medical home and expanding their cash-based sources of revenue with helping their community stay in their homes and age in place.
Absolutely. Age in place. And I came from long-term care pharmacy, Debbie, and there aren't facilities in certain communities anymore to take care of people that are in need of skilled nursing or something very specific with compounding or infusion or whatever it is. The future pathway to that is community pharmacy. If you want to take the next stage, there are resources, and that's a key word of today's interview. A resource for me personally in my career in pharmacy has been partnering with people that know what's going on at the trench level. I don't. I'm not a pharmacist. I'm not a pharmacy owner. So I trust people who are in those trenches for their communities. Lisa Fasst, Dr. Lisa Fasst, she was one of our Pharmacy 50 most influential people in the profession of pharmacy, and there's reasons for that. She had community pharmacy stores that she was caring for, and she was seeing the impact that her presence was having on her communities. And then she had to fight as a community pharmacy owner in order to box her way out of the ring of where community pharmacy was going because of the pressures of big box stores and PBMs and collaborative agreements working and not working. And it's almost like she created this environment so you could test things. What works for community pharmacy for real? What doesn't? What's fluff? What's, pulling the covers back on technology to see what works, what doesn't. So when Lisa joined PDS, Pharmacy Development Services, the whole organization kind of went into an acceleration. It thinks of Fast and the Furious movie where the cars hit the nitro button and it just like the organization forward because she was practicing what she was preaching. She was designing what she was practicing. And she was like, that's it. I cannot bottle this up. I'm giving this to the rest of our community pharmacies out there. And who was part of that organization. Thank you so much, Dan, for starting it and where it went. And then had to keep leveling up. If we don't keep moving, if I don't keep evolving as a publisher, Debbie, I'm going to be superseded by some other content development organization. I have to keep in thought, what do my listeners need to be successful providers? What do my listeners need to be successful community pharmacy owners? That is why you are part of this network, Debbie, is because you are empowering pharmacies to do more for their communities and make more money. Dr. Lisa Fasst, you are a champion. You are a pirate because you're fighting for the gold and the jewels of good health for our patients. I'm so excited to be in your inner circle for the Pharmacy Profit Summit Live that's coming up in August. But Lisa, welcome to Happier at Home PRN.
Thank you. That was quite the introduction there, Todd. I like being called a pirate. That fits. I think that fits me well. So yes, and it does feel like it's been a fight. It's been a fight to not only for my own personal businesses and the pharmacies that I've owned, but also a fight for pharmacy owners that. Unfortunately, many of us got jaded early on in our careers from some bad seeds, and it became this like profit is a 4-letter word, like profit was dirty. And pharmacy owners started shying away from profit. And it's like, you can't do that when you own a business. You can't do that. And I've been kind of fighting my way for not only on behalf of myself, but on behalf of all the other pharmacy owners out there that it is okay to make a profit. There are good, solid ways that help your patients, that help your community and help you. And that's been my passion now for going on, I don't know, 2 decades now. I'm getting old these days. And it's fun and it's exciting and it really truly is my passion. And I'm blessed that I get to get up and work with pharmacy owners and work with people like you that may not be pharmacists, may not be pharmacy owners, but you guys care about this industry. You care about the owners. And it's just awesome to be able to collaborate and expand that network of people who are, I always think about it as like creating an Avengers team. It's like getting to network with other people that we all have our different talents. We all have our different backgrounds, but we're here to protect the good of this industry. And so it's awesome to get to collaborate with you guys, with Todd and Debbie and the other people that you have on the PPN network. I mean, that really is the Avengers of independent pharmacy. So.
I like that. Debbie, when you think of what has been created with DiversifyRx and the practice of evolution in community pharmacy, now take what home care has traditionally done that wasn't part of community pharmacy, and you're infusing it onto that, and just talk with Lisa about that concept of doubling up on that as a community pharmacy care provider, and then, of course, home care.
Well, first of all, I'd like to say that Lisa would look incredible in a pirate's costume. She would look very cute and rock that. So she is a rock star no matter what. But so I was so lucky to start talking with Lisa about my home care company. And I'll never forget the phone call that we had. And she got it when I started telling her, if we can collaborate and bring community pharmacy owners a home care business model that will help them to connect their patients with services to be able to stay in their home, thereby also increasing your pharmacy business. Let's do something like that. And she knew exactly what I was talking about. So Lisa has said it before. I've said it before. As a pharmacy owner, if you're standing still, you're falling behind. So you really need to make sure that this marriage between the medical home model, I almost look at it as 3 different things. So you have the medical home model for the pharmacy, you have Happier at Home and our home care services that you would provide in the home. And then you have your actual community pharmacy and all the other services and the retail and the different streams of revenue that you could create that way. So I think that what Lisa is doing right now, and I'd like to actually kind of delve back into some of your background, but what Lisa is doing now with helping the pharmacy owners, she's able to bring all of those resources together and be that strong, the strong anchor and resource to disseminate all these resources for the pharmacy owners and for those that are in her university and those types of things. So it is, I think that if you look at the big box stores, they're expanding into home and community-based services. They're trying to capture that before our community pharmacies do. So you really need to get on the boat and get moving. So Lisa, as far as I'd like to, as I said, kind of go back and understand what kind of mind you have, what your brain is like, and kind of connecting that to your risk taking and your being a business person. So I got to know, as a little girl, what were you like growing up? Were you a tomboy? Because I was a tomboy.
Very, very much a tomboy. My mom used to have to barter with me to wear a dress. Like, she would make hey, I'll get you this, or you can do this. And yes, very much tomboy, very much, we grew up with horses and animals and things like that. And, obviously back in the day, it was, latchkey kid, we were responsible for ourselves after school, all those kinds of things. And, we knew when we had to be home. And if you weren't home, you got your butt whooped, and, you learned your lesson and all those kinds of things. So it was a great time. I think the time that I got to grow up before, social media, before helicopter parenting and all those kinds of things, that it made me very individual, very self-sufficient, sometimes a little too self-sufficient, but made me very self-sufficient. I knew how to cook, I knew how to clean, I knew how to, do all those kinds of things. And, that certainly formed who I became as an adult. So.
Yeah, very good. That's, I think back of being a child, and if I knew what I was looking for then, I would have known that, yep, I am going to be a leader. I'm going to be in the middle of everything. And I think that probably if you think about that, and for you, it would have been the same. So how did you actually decide to become a pharmacist?
Yeah, I did not grow up around pharmacy. Like, my parents weren't in pharmacy. I didn't have family in pharmacy. I'm one of those weird anomalies of somebody who's in pharmacy who has zero connection to pharmacy. And really, when I was in high school, I always thought I was going to be a chemical engineer. That was where my brain was going. And then in my senior year of school, me and my best friend, and his name was Justin, and we had to do a project where you had to shadow somebody in a career and do up a paper and stuff like that. And I didn't, I come from fairly low income family. They're all blue collar workers, retail workers, kinds of things. And, I didn't know anybody with a career. Well, my best friend's mom happened to be dating a pharmacist. And so we're like, we can go shadow them. And so we went and we shadowed them, and we had to learn all about pharmacy and the schooling and, all those kinds of things. And we realized, wait a minute, we can get a doctorate in 5 years and be making $200,000 and life is good. It was mind blowing to me as a kid who, thought, $10 was a lot of money. The salaries that we were seeing at pharmacies back then, and granted, this is in California, so they were even more inflated. And the amount of schooling that we could do, because they had just kind of really launched all these accelerated doctorate programs. And I was just like, yeah, sign me up for that. Because I'd always wanted to be a doctor, but frankly, I need my sleep. And the whole 24-hour, 48-hour residency schedules, that is the entire reason I didn't become a doctor, which seems so silly now, but I was so scared of not being able to sleep. And so I was like, that's okay. I was like, let's do chemical engineering. And so it seemed like this perfect mesh of all the chemistry and stuff that I loved with healthcare. And, during that time, I grew up having to take care of my grandma. So my mom was one of the youngest of a ton of kids, as they were back in those days. And so my grandma was much older. She had diabetes. She pretty much lost her sight, lost a lot of her control. So we always had to go over either before school or after school and give her insulin and do all those kinds of things. And so I kind of had this healthcare background in me. And then it was really this senior project that really came together where we had a shadow of pharmacist. And I was like, sign me up for that. So at the very end, I remember the week before the deadline for like early applications to college, I applied to one pharmacy school. And because all the rest of them were chemical engineering schools, and I applied to one pharmacy school, which is University of the Pacific up in Northern California, and got it in just by the deadline. And thankfully I got accepted and it all worked out. But yeah, I was all riding, all my eggs were in one basket. So
Wow. And I don't believe that you actually sleep now. So that didn't make a difference.
No, I am one of those people, like my husband says it's my superpower. Like I can be talking to somebody and then literally 5 seconds later, I can be asleep. Like I can fall asleep at any time, but I'm one of those people. I learned very early on that I can't do all nighters. I can't do, like, I just don't function. And so yes, I get my sleep.
That's great. I know. I love sleeping. It is one of those,
it's my favorite hobby.
It is. I love my bed. It's just one of those things you have to do to rejuvenate yourself. So yes, I agree. As you went through your pharmacy school, did they have things? Did they talk about business at all? Did they talk about owning your own business, or have you explore that while you were going through pharmacy school?
You know, I wish they would have. Not that I may have even listened, honestly. They did have this dual program of an MBA and PharmD, but that was really geared towards people who were going to go into like pharma executives and things like that. And so I didn't take the MBA program. And at UOP back in the day, I'm getting old, there was only 3 pharmacy schools in California, and they all kind of had their role. So UOP was like the retail school, and then UCSF was like the clinical research school, and like USC was like the hospital school, like, and that was like just what they were known as. And so not a whole lot of talk of entrepreneurship or business or anything like that was discussed. And so, you know, I went through school just expecting to, I actually wanted to be a nuclear pharmacist. Like that's what I thought I was going to graduate and go do. And, you know, and then when it came out time to graduate, Syncor, which was the big nuclear pharmacy, they were booked. You know, this is back in the day when most places were doing signing bonuses for pharmacists and, you know, giving away cars and BMWs and all these kinds of things because there was a shortage. But yet Syncor, you know, they were full. And so I was like, crap, what am I going to go do? You know, so I was like, I'll have to go be that retail pharmacist. And so it was like all along the way, like nothing, everything kind of seemed to change kind of at the last minute. But yeah, so I had no schooling in entrepreneurship or anything like that. But just personally, me and my brother both, just whatever the DNA is, we're both very entrepreneurial, and we'd own businesses, and we had to earn our own money in school. Cause like I said, we came from a lower income family. So if we wanted anything, we had to go earn our own money in order to buy it and those kinds of things. And so all of that kind of was the foundation for kind of understanding entrepreneurship. And, my brother and I have gone into business together before we even opened. I opened the pharmacy. You know, I've owned a used car lot before. You know, me and my husband have owned tons of businesses, from paintball to sports youth organizations and all kinds of things. And so now I just have a love of business. So I love business, and I'm one of those weird people that love numbers and like love marketing and those kinds of things. And then so I get to layer that on top of all of the pharmacy stuff, which, you know, then that's where my passion really goes, is where all of that kind of layers on. So, yeah, I never could have probably dreamed of this path. And, you know, if my school had offered business, I probably wouldn't have took it, because I had no idea that, you know, I was going to be going in that direction anyways.
Yeah, I completely understand that. You know, just having that entrepreneurial mind and wanting to start businesses, you know, that was always something that I felt like I had in my DNA too. And there's not really I really never saw myself expanding into a national home care company. But here I am. So seeing the different types of things that we thought we were going to do and what our trajectory seemed like it was going to be, then there were barriers in the road that kind of changed it, and in a good way. So if you think back, if you could think about maybe one challenge that So many of us have so many different challenges that we've overcome that have brought us to a better place. But is there one challenge that you could think of that you thought at the time, darn, this is not good, and it ended up to be a blessing, and that if you were someone who felt like you were victimized, maybe you wouldn't have taken advantage of it. But because you're someone who perseveres and pushes through, it turned into a blessing, something that you learned from. Can you talk about any kind of challenge like that?
Yeah. Well, I mean, the hardest thing that I've ever gone through is my legal dealings with our board of pharmacy in California. So I was running my pharmacy, fan-freaking-tastic. It was a wonderful pharmacy. And I got into dispensing medications via telehealth. I got in, and I was one of the very first pharmacies that partnered with some of the early telehealth companies and filled prescriptions like amoxicillin and erectile dysfunction and birth control, those kinds of things. And this is back in 08, 09, somewhere around there. And then I ended up getting in trouble with the Board of Pharmacy because the California Board of Pharmacy said none of those prescriptions are legal, even though, I can get into a whole other conversation about the law of that. It's funny. They still have the exact same laws on the books as they did back then, but they ended up saying that I illegally dispensed all of those prescriptions via telehealth. They didn't recognize telehealth, even though the California Medical Board did. And, it was this whole thing. That's the problem when you sometimes are innovative and you talked about risk taking before.
Yeah.
That whole adage of, you get bloody going through the wall. I was one of those first pharmacies to fill telehealth prescriptions. And that ended up being the downfall of my pharmacy. I mean, that's ended up because I settled with the Board of Pharmacy. We did this whole thing, did the whole lawyering thing for a couple of years, and I ended up settling, thought everything was fine. But I really, really pissed off the president of the Board of Pharmacy back then. And she took out a personal vengeance against me. And so after we had settled, after everything was fine, I heard through the grapevine, because I had connections that she didn't know that I had connections with, that she was going to come after me and she was going to shut me down, personally. And so that really scared me because my entire pharmacy was our entire family's wealth, if you will, like everything that we had put in, we weren't saving in retirement. We weren't doing all that. Like everything was in this pharmacy. And it really scared me that she might come after me and make it all dissolve, because it could just dissolve away. It would just like a salt cube in water, it would just dissolve away. And we started to see some of that. And so I quickly decided that I needed to sell my pharmacy while the value was still there before things had happened. And so I sold my pharmacy for a couple $1 million, sold it to CVS, and retained that value that, we had built in there. And that's when I went to work full time for PDS. So I was a member of PDS before, and Dan had helped me through that process of selling the store. And he's like, hey, come work for me. Because I did everything that I created in my pharmacy. I'd always shared with other pharmacy owners. I don't have a scarcity mindset. I really come from an abundance mindset. Whereas I believe that there's more available than, any one of us could ever possibly handle. And so I was always creating programs and sharing them with, the membership and things like that. And so that's when I sold my pharmacies. This is back in 2012. And so it seems all fine now, and I can talk about it now, but going through that was the darkest period of my life, like very, very dark. And I won't even go into how dark, but I lost my identity. I lost my entire confidence, because I was always one of those people that was like the smartest person in the room. I always did things right. I never got in trouble, never did anything wrong, and so my entire identity was shaken during this whole process. And I carried around this huge shame, like this just shame that, and unless you've done something in your life that you're very shameful of, it's very hard to describe. But it was just this entire weight that was around me. And I thought I would never get out from it. The way that other professionals looked at me and, because I got in trouble with our board of pharmacy, like, good God, like how terrible of a pharmacist, am I? And, it's kind of funny looking back. It's like, people who stole and took their own oxy were treated better than, somebody like me who all I did was fill telehealth prescription, which everybody does nowadays,
Yeah, you were ahead of your time.
Yeah. And so I carried around this huge shame. Like, I mean, not just a chip on my shoulder, like I had chunks missing from both shoulders. That was, and I'm not even embarrassed by it anymore. It's like what you said, like I've now healed. Like I really had some PTSD post that. Like I used to not be able to talk about it without like having full breakdown and meltdowns. But what that did though was make me super, super good at vetting things. Like now I look at everything, whether it's compounding or DME or telehealth or those things, like I can now dig into companies because I've had so much experience with lawyers. It's funny. I actually ended up getting sued by PDS last year or the year before. I won, by the way, I won't go into it much more than that. Woo-hoo. And when I was talking with my lawyers, they're like, are you sure you don't have like a legal background? And I'm like, I just have a lot of experience. Like,
you know what? Be burned once and then they'll understand. I've been there. There.
Yeah. And so I'm really good at like vetting things out now. Like, so when you talk about your risk level, I'm still very risk taking. Like the way that I evaluate risk is like, what is the worst that can happen? What is the absolute worst? And can I live with that? Like, do I have a plan for that? And if I have a plan for that, then anything else better is just better. Like as long as I can have a plan for the worst. And so I'm still taking risks, but man, like in terms of vetting companies and talking, like I talk with a lot of industry folk. I got into like PBM compliance and billing compliance, and I got down into the nitty gritty. And so all of that hurt and shamefulness and things that I went through with the legality of my boards, I've actually been able to help hundreds, if not thousands of pharmacy owners from that experience, not only with them dealing with their boards. Like I have good friends, I have members that's like, I just got a letter from my board. What do I do? Like, here's the 10 things that you need to go do if you get a letter from your board. Like I got this down, like I've been able to help them through those periods in their life when there isn't a lot of people, because people don't talk about it. When you're professionally, slapped, you don't generally go out and talk about it and say, hey, if you get professionally slapped, come call me. And so I've been able to really help a lot of people if that happens to them. And I've been able to help a lot of people stay out of trouble. There's companies that I won't work with. There's products that I won't promote. And it's because they don't pass the vetting process, because I've gotten really good at vetting after being in that kind of hot water. And so I've been able to turn all of those really bad, harmful, shameful things that I didn't think I would ever get over into really helping a ton of pharmacy owners stay clean, stay in compliance. And I always like to say, like, understand the rules, learn whatever you want to do, learn the rules, and then just stay inside those and then go forth and multiply, and that's really important that you understand those rules. And so that to me, that's the biggest thing that I've ever had to overcome. And it was a years long process. I know that was like 10 minutes, but it was like a years long process to be able to get where I am. But once I started seeing how my hurt was helping others, that actually helped heal me more. So when I kept quiet and I kept it to myself, I continued to hurt more and I continued to not make progress. But when I finally was brave enough to start talking about it and then able to help others, man, the healing just went on, light speed. And, now we're here where today where I'm able to talk about it. I don't get emotional. I don't cry. I don't, go bury my head in the sand for, a week afterwards, which, are all the things that I used to happen whenever things would come up. So,
well, thank you for sharing that with us, because I think that just as you said, there are people who go through things and don't talk about them and feel that they're walking it alone. So to know that so many of us have been through some pretty major challenges, thinking back in my own life and being a vice president of a very large company in New York here, I had a similar problem. I mean, it was not compliance and it wasn't having to do with pharmacy, but in my position, once I wanted to leave that organization, boy, they loved me when I was there, but talk about problems when I wanted to leave, and personal vendettas afterwards, because I think what it comes down to is that those people in power, this woman that knew you in power, could not control you. They couldn't control us. And I'll never be in that position where someone's controlling me anymore. And so I think just making sure that you rose above and turned it into something great. Congratulations. And I know for so many pharmacy owners out there that you really, really helped them and continue to. And I know that you're just one of those, you're one of those beacons in the storm for people. So I know that you went through a lot, but it gave us you. So cool.
Yes. Yeah. Well, that's the way I tried it. And I had that perspective now, we're post 10 years, later, and it's easy to talk like that now, but in the middle of it, you feel like your world is ending, and it's hard. That's why it's hard to talk about it. It's hard to be vulnerable. Obviously nowadays, maybe with mental health and some of the acceptance of vulnerability, but I still think in the professional space, especially when it comes to like legal and compliance, you're immediately thought of as just an outcast. You might as well be a leper, back in the day of, don't touch her, don't talk to her, because you made this one mistake. And luckily I've grown past that. Like, people can't hold that against me because I've proudly display it, whereas before somebody could hurt me. If they even just brought it up, I would, cower and go hide. And now I've just learned that the more that you share, and that's why I share my successes and I share my losses, and I own pharmacies, and I've tried to share the journeys of buying those pharmacies and the things that we've done right and the things that we've done wrong, is because I think we can all learn from each other's shared experiences. And I think in the world of social media, we always like to put our best days on social media.
Oh yeah.
And, we don't put the hard days on there. And I tried as much as possible to put the hard days on there as well, along with the good days, because that's just, it's just realer, and it allows you to actually help people, which is what we're here about, is to actually
people
help
can
people.
associate with you then. And actually, jumping back a little bit to the time period when you decided to, did you buy pharmacies? How did you start your pharmacy or pharmacies?
Yeah. So my very first pharmacy, I started from scratch. So I started that all on my own. And that was after another disappointment. I had left my job at Kmart, which was a fantastic company to work for in the pharmacy department. And I went to work for my friend's pharmacy because he was going to be selling the pharmacy. So I was going to buy it. So I went to start working for it while we went through this whole SBA process. And the SBA process was not quick.
It's horrible.
Months and months. I had no idea how long it was going to take. And he was really eager to sell. And I finally got a call from my SBA officer that said, "We've approved your loan." And I'm like, hey, I call my friend up and I say, "We finally got approved." And he goes, "Oh, I sold to Rite Aid last night." Literally. Man. And so it was like one of those things that's like,
talk about a day late.
Yeah.
Dollar short.
And day late, dollar short kind of thing. And so that was actually what prompted me to start my own pharmacy. I was like, well, I already have this vision. I already started putting a lot of this into place at the pharmacy, where I was working with him at. And I guess I'll just do my own. Like, that was like, and then that, to your point, it was like, what's the worst that can happen? If I start this and it completely fails, I get to go back to my $200,000 a year job, and that's okay. I can live with that. Like, that was kind of like all right, let's go start this on our own. So we went back through the SBA process, redid a business plan for a startup as opposed to a buying an existing. And that's how I started my very first pharmacy to begin with. And so when I sold that pharmacy in 2012, because of all of the legal stuff, I did not get back into pharmacy ownership for several years. Like there was no opening that wound. But I actually ended up getting back into pharmacy ownership. You mentioned Todd. So Dan was the original founder of PDS. He's a mentor of mine and a good friend. And I went into pharmacy ownership with him on several pharmacies, and kind of did that thing. I got out of those pharmacies a year ago or so, some time ago. And I have a new business partner now that we own pharmacies in. So we've owned, I currently own one pharmacy in Oklahoma and one pharmacy in Louisiana. And we've owned those for almost a year now, actually, coming up right upon a year. And, so I've been working on those, growing those, and doing all the things with those. And so I've been kind of in and out over the years. Had more locations, gotten out of some locations and those kinds of things. But I like owning pharmacies. Because one, they're investments, they're a way to make money. And I believe in diversification, not just of pharmacy revenue, but my own personal, revenue. We own multiple businesses and things like that. But it also keeps me like you said, Todd, you like dealing with people in the trenches. Like, it feels like it keeps me in the trenches. Like
Exactly.
I get those faxes with those really crappy contracts, just like everybody else.
Yep.
And I get all of those kinds of things. And I get employees who, calling and quit, 2 days after saying yes to start working, and, all of those kinds of things. And so it keeps me real, as you will. Whereas, there's a lot of other people that I think come into our industry, especially from outside of pharmacy, and they're like, oh, I can help you run, a better pharmacy and more profit and this and that. But they've never been in pharmacy. It's one thing to be like, hey, I know how to run business, but pharmacy, we are just a unique little bunch. We are just.
It really is. Yeah. And actually, it gives you credibility for what you're practicing,
and,
what you preach, right?
Yep. And I love listening to people, and it's like, oh, I can double your revenue with this tactic. And I think, yeah, but you forgot to finish the sentence. You'll also demolish their cash flow and they'll go out of business in 3 months. It's such a complex business thing that we're in pharmacy, because our financials are not like any other business out there. They're not like a doctor's office. They're not like a dentist office. Our cash flow is completely different. Obviously our regulations are completely different. It's just a unique bit. So it really does. And not to say that those people have ill intentions. They think that those skills will transfer over to pharmacy, and they just don't always.
And actually, I could speak from experience with that. So as a franchisor, I started the entire organization of Happier at Home. I ran my company since 2007. So if you don't have that basis, if you don't have the experience of working in it day in, day out, knowing every aspect of that business, how are you going to teach someone else how to do that? You can't. And to be able to understand if there is a new offering, how are we going to incorporate that? And I'm going to show you first. So I'll do it first, and you'll see how well it works. So.
Yep. Yeah, and that's what we do at our pharmacies now. So like right now at our pharmacy in Oklahoma, we're just starting an allergy testing program. I have no idea if it's going to work well. I use my pharmacy as guinea pigs first, kind of see if it works. Not everything is a fit for every pharmacy. So if there's a program out there that maybe I can't guinea pig in my own pharmacy, I have some close friends or close members that it's like, hey, there's this opportunity. It might be a good fit. Let's think about it. And so I can't try everything out in my pharmacies just because we don't do everything, but I always try to do it on my own. If not, then, we at least test it out in some other pharmacies because not everything works. So just because you have a great idea and you have really smart people doesn't necessarily mean it's going to work and it's going to integrate, into pharmacy and do those things. It's kind of like collaborative practice agreements and those kinds of things. It's like, it's a great idea. And then you find that, hundreds of pharmacies learn about it and then they all run up into the same barrier. And it's like, crap, how do we get rid of that barrier? And so I like starting things really small. I like growing nice and slow. I like organic. I like, a lot of people will be like, oh, you should have 1,000 members, by the end of this year. And I'm like, actually, I'm really happy with our 240. Like we're not
Build
actively
that
promoting
solid foundation.
our membership. Like I like to grow nice and easy and figure stuff out, because I would rather keep patients, in my pharmacy, I'd rather keep patients happy than churn patients and constantly having to market and bring new ones in. And the same thing with Diversify. I'd rather keep pharmacy owners happy rather than churn them out, get them angry at me, and, constantly bringing in new people. So I like to test things. I like to take it slow, verify it. Then once we know it's a good thing, then you pedal to the metal and you tell everybody about it.
Right. So now I mentioned that you and I met at one point before we had that conversation through PDS. It was a long time ago. What was your role in PDS at that point?
Well, I don't remember at that point. I did just about everything in that company.
Okay.
I was at one point throughout the years, I was head of marketing and head of business development, which is probably where we met through business development, because I became so good at vetting companies. All of the new companies would kind of come to me and I would vet them and look at the legality. Like, gosh, I remember when CBD started becoming a thing, like that whole legality. And I would have to talk to the companies and ask them all the questions to make sure they were compliant with all of the farm bill rules and the things like that. So it was probably in capacity of like business development somewhere along the way, but I literally held just about every position but CEO in that company at some point before I left. And I left in 2020 now. Wow, gosh, almost 3 years ago, but I left in 2020. So
yeah. And so I was with PDS for a few years, actually went to their conferences as a vendor and met some pretty incredible people, and actually am still connected and hearing from people and pharmacy owners that met me at PDS. But now we turn our sights to things that are an improvement upon what you may have found in different ways in PDS. You starting DiversifyRx. So I'd like to hear about how you started it, maybe some differences in what it's like in comparison to PDS, and what you learned through that experience that you made sure was going to be different with DiversifyRx.
So when I left PDS, I didn't have a plan. Like I didn't know where I was going to go. It had just become too incongruent with my beliefs and what I wanted and what I was trying to do for the industry that I could no longer do it when inside that framework. So I decided to exit that framework. And I think that happens when anytime you have a healthcare company or even any specific niche and you get outsider people coming in, I think there just starts to create that friction. And for me, I was always a pharmacy owner champion first. And so whenever that just became too much is when I decided to step away. And so luckily after I left PDS, I found a job with Wellgistics as their chief revenue officer. And Wellgistics still around today. They're an awesome company. They had just gone through some internal changes and they needed some kind of new leadership in some of their marketing and sales roles. And so it ended up being like perfect timing. And so I stepped into that role, created, a new sales process and new kind of stuff for them. And at the same time is actually kind of when I started DiversifyRx. I started posting blogs and I started educating because I was on the wholesaler side now, which was drugs, but there was still this whole other business side of things. And so I didn't know exactly what I was going to do with it, but I just was kind of doing something. And I ended up being at Wellgistics for 6 months and left February of 2021. And I was kind of left with like, what do I want to be when I grow up? Like, and I really realized that I'm not a very good employee. Like I can only be so good until I'm not, it's like, I'm really good until I'm not. And that is usually come when I think I have a better way of doing something, which my brain thinks it has a better way of doing something. Like you asked me earlier, like, how does your brain work? Like, I can look at problems and it's like this weird spider web, like firing in my brain. And then like, I just see the way through. Like, I can problem solve probably better than anybody. I always like to say, tell me your problem. And then I can like come up with a solution. And so I love creating solutions to problems. Like that's what my brain is the best in the world at. And So I was applying for a bunch of jobs and I started to think like, maybe it's time to leave pharmacy. Like maybe it's time to like, get out of pharmacy. I've been here for 20 years. Like maybe it's time. So I started applying for like, marketing positions and sales positions and things like that at these other companies. Because I live in Dallas now and there's no shortage of a plethora of companies and things like that. And the only thing that was kind of bothering me, like, that little tickle in that independent gland, like, in your heart was, wow, I'm not going to work with pharmacy owners anymore. Like, that's sad. Like, that sucks. And so that's when I really started working on Diversify. I was like, well, I'll just keep sharing information. Like, I'll just keep putting it out there and I'll keep, because I have all this knowledge in my head, and I wish I could just plug it in and just download it. But I was like, I'll just keep sharing information while I look for these other jobs. And I had applied for a job with McKesson, and nothing wrong with McKesson, but they, I didn't hear back for like a month or 2 months, like, time had gone by. And then I finally, like, after I got to the point where I applied to McKesson, I looked at my husband and I'm like, what am I doing? Like, why am I applying for all these jobs? Like, we always joke about how I'm a terrible employee. Like, I don't know what I'm going to do, but I know I love helping pharmacy owners. Like, I'll figure it out. Like, I love figuring stuff out. So, and to your point, like we talked about risk earlier, what's the worst that can happen? And I was like, it goes nowhere. And I continue to apply for these jobs that, I'm could go do. And so that's when I really decided, like, all right, I'm stop applying for jobs and like Diversify is going to be like our future. And that was when, 2 months later, we held our first Pharmacy Profit Summit. That one was virtual because that was in the middle of the pandemic. That was in May of 2021. And then we had our first in-person summit in July of that year, I think it was. And because we had that little lull, before like Delta came, like, we didn't know what was coming, but, and so we were able to have that first in-person summit in 2021 here in Dallas. And it was like, after that, people were like, what can we do? How can we join? Like, I didn't have anything to sell. We were just, bringing together just amazing, awesome people. I remember that 2021 show was the first time Adam Robinson had spoke. Yep. And that boy just can't stop being on fire, since then. And, we just brought in like these really great people. And really it was out of demand was where Pharmacy Badass University came from, because it was in that July show when they're like, we want to join something where we can learn from you. And I'm like, oh, I don't have anything. Let me figure this out. And that's when we started working on the membership. And then we ended up launching the membership March of 2022. And so that was kind of like this weird, crazy path, didn't plan it, didn't know where I was going. And so, to your point of like, how is it different? And I think that's a really good question, because obviously I came from PDS. And a lot of people look at Diversify as PDS 2.0. And frankly, that really pisses me off. Just putting it out there. Because to me, it's nothing like it. Especially the way it was in the end. Now, if you compare me to PDS, 1999, I probably am somewhere around a 2.0 version of that. But especially where it was at the end when prices were skyrocket, everything was nickel and dime, everything was timed. It's like, oh, time's up, like you're on your therapist couch and, things like that. And there was just a lot of things that obviously bothered me, which is why I left the organization. And of course, now PDS is not in business anymore. They went out of business November of last year. And so there's a lot of things that I purposely did different. One is my prices are super low. I actually encourage people to use all my free stuff first. Like, please go use my free stuff, go forth and multiply on that. And if you never pay me $1, I am A-okay with that, because
you're talking about your resources on your website.
Yeah. Yep. Our resources on our website, YouTube, podcasts, blogs, ebooks, you name it. There's a ton of free stuff out there. Because my mission is to save independent pharmacy. And I can't save independent pharmacy talking with every single pharmacy owner. There's just not enough, Lisa, to go around. So we post a lot of stuff up there and we put a lot of free stuff up there and people use it. And that's great. Like that's all that we need. That's all that, sometimes that's all they need is to be able to go do that. And so, please go use our free stuff before you ever pay me $1. So one is I encourage people to use our free stuff. 2, our prices for our membership are really low. They start at $297. Our highest membership, which is our all-inclusive, unlimited coaching, everything in the kitchen sink, is $797 a month, which is far less than PDS was, far less than a lot of other consultants are. And so I think a big differentiator is price. And I don't believe in contracts. I don't believe in holding people into something. If they don't like it, I don't want them to stay. Like, I'd rather part as friends. And if it's not a good fit now, it might be a good fit in the future. But I always say, I don't want people's bad juju money. Like, if they hate paying me every month, I don't want that energy. Like, I don't, like, please, like, so I don't have contracts. People can come and go as they dang well please. Thankfully, we have amazing members. Most of our members stay. Once they join, they've stayed. We've been around for a year now, and we still have over 90% of our original people, our beta people that signed up. And so I think there's some very, very big differences there just in how we approach the pharmacy owner. We try to meet the pharmacy owner where they're at. One of the things that always annoyed me about PDS was they'd have a call and it was live and it was like not recorded. And it was like at this time, and it's like, so you had to, I remember being a member and having to like rearrange my day so I could join this call because I knew it'd be really helpful. But, I knew I wouldn't have access to it later if I didn't join live. And so in our world, we record everything. Everything's available on the membership site. It's like a big Google Drive of everything pharmacy business related. Like, we put it all in there. And we try to meet the pharmacy owners where they're at and try to make it as convenient for them as opposed to convenient for us. And so, anyway, so I think those are some like fundamental differences. And I know on the outside looking in, it might all look the same because PDS was trying to help pharmacy owners increase their profitability, enjoy their businesses, enjoy their life better. And ultimately, that's our goal too, is we want them to increase their profitability, enjoy their life, and, make their lives better. But how we are going about doing it, I think, are fundamentally different, which is one reason why, we've been really successful without I don't have a sales team. I don't pay people commissions. We don't hard sell anybody. I don't even generally promote the membership. Usually it's people like, hey, I've heard you had this thing and I want to join. I was like, oh yeah, like I haven't posted the link in a while. Like, here you go, here, come sign up. And because I love growing and I love new members, but I want to make sure, frankly, that I had something good because that thing in me, that chip on the shoulder, that I still carry from all those other things. I want to make sure that I give people the best value in pharmacy. Like, I never want somebody to say, I paid Lisa $300 and she sucked and she never did anything to remedy it. Like, I don't want that ever to come out of anybody's mouth. So I'd rather grow nice and slow, make sure our pharmacy owners are absolutely love being members, before we just get out in a whole bunch of new ones. I'm not one that's married to vanity metrics. I don't need to prove to anybody how fast we grow or things like that. I'm not trying to get VC capital or, something like that where you're like, hey, look at our growth chart. I just want really happy pharmacy owners that make themselves a lot of money and have better lives. And, to me, like that's what our goal is. So anyways, I think those are some of the fundamental differences between us and PDS. And I learned a lot of what to do and what not to do being a part of that process. And so hopefully I'm able to bring some of that knowledge forward.
I love getting your almost daily kick in the butt emails. Oh, are you doing this? And do you know if this happens, then are you focusing on this aspect? I'm not a pharmacy owner, but I love looking at those because it really, I think there's a lot of transferable suggestions you have for anyone in business. But also it helps me to learn about what the pain points are for pharmacy owners and how we at Happier at Home could help them to either alleviate or resolve or help to cushion the blow of some of those problems too. So I really appreciate that. So your the membership, is that separate from the university itself, or is the university kind of incorporated in one of the membership?
No, the
levels?
Membership is it. So Pharmacy Badass University is our membership. And so,
okay, got it.
Yeah, that's what we call our membership, because I'm trying to create pharmacy badasses. I'm trying to create pharmacy owners that can persevere, because who knows what's going to come in 2 years? There's going to be something. Like I always say there's never a dull day in pharmacy. There's always some new challenge. Right now in 2023, we're dealing with impending compliance changes in terms of like DEA, supply chain, boards of pharmacies, hazardous drugs, like all of those things are coming up in November. Like November is going to be a chaotic storm for pharmacy owners. Then as soon as you're done in November, January is coming around with the whole DIR fee apocalypse that we're calling it, which is the changes to DIR fees, which in the long run is a good thing. However, the short term for the next 4 to 6 months of 2024 is going to be very painful from a cash flow perspective. And so, like there's always things changing in our industry. And you know what? Unfortunately, the days of I'm just want to be a good pharmacist, I want to dispense prescriptions, I want to open my pharmacy at 9 and close it at 6 and go home, like those days are gone. Like, and if you want those days again, like maybe you can have them in like tiny little like cash only places or compounding only pharmacies. But for the majority of us out there that are retail pharmacies, like those are in the past. Like we can't live on that. We have to do pharmacy different, and doing pharmacy different. That's why the name of my company, DiversifyRx, that's where it came from, is you have to be diversified. You no longer can just dispense prescriptions and expect to make it anymore. You have to, I always talk about a profit lasagna. And so, if you think about a lasagna, you make it and it looks beautiful at the end, but you have to do it one layer at a time. If you try to like throw it all in there, it becomes like a goulash, not a lasagna. And so
I want happier at home to be the best part, the sauce.
Yes, exactly. And you need lots of garlic and salt.
Yes.
And so when you build your pharmacy and you build your pharmacy business, it needs to be done like a lasagna. And so your dispensing, is always going to be that foundation. Like that's what we do. That's what we're here for. We're dispensing. And that does not make a lasagna. Like what else can you layer on top of it? And I'm a huge fan of cash-based revenue, which is, why I immediately, many years ago, like was attracted to your guys' business model is pharmacies already have all these patients. What else do they need? Great. I don't have to go market for these patients. I get to just sell them more stuff. Fantastic. Like sign me up. As somebody who's owned lots of other businesses, the biggest hurdle you usually have is attracting your customer and getting your customer's attention. As a pharmacy, what most pharmacy owners don't know is they're sitting on a gold mine. They have thousands of patients that have other problems and we can solve them. And so you don't have to pay marketing dollars to go be in front of those people. You're already in front of those people. Now it's the time to just go sell them that other thing. And I know Happier at Home, most of your stuff is geared towards like the elderly and the people who are like home ridden. But I know you and I talked about this a year ago, but about 10 months ago, my sister-in-law had a stroke. And of course, we didn't know what her outcome's going to be. And long story short, she's amazing. But in those first couple weeks and months from home, she needed help because she couldn't drive. She couldn't do certain things. And the first thing I called you was, is there a Happier at Home franchise where she lives? Like and so it's not just the elderly, but there's other things, sometimes acute, sometimes chronic. Somebody breaks a leg, they can't drive and they need services brought to them at their home. There's lots of things, even children now, there's obviously children that are bound in home and things like that. So I think there's just a huge opportunity for pharmacies to do these add-on and layer your lasagna of services that the foundation of your patients are your core customer. There are other problems that those patients have. Now, whether that's supplements, it's at home care, it's point of care testing, it's genetic testing, it's whatever the case may be, but you're layering it on top of the things that's your foundation of your patients. And so to me, that's how I see pharmacy. That's how you build a profitable pharmacy. And you optimize every layer along the way. You make it as good as possible. You adjust the seasonings, you add a little more salt, you optimize each layer before you go on to that next layer. And so that's my philosophy of owning and building profitable pharmacies. And that's why I love, networking with people like you, because you add a beautiful layer, into that lasagna that takes care of so many things that ultimately takes care of that, makes that patient better, whether it's that particular patient or it's their life better because now you're helping with their mother-in-law that they were previously having to spend hours with, doing things and stuff like that, and so you're helping better the outcomes for them.
Yeah, thank you. And, thinking about your connections with physicians' offices, and if you're doing any kind of long-term care, you have those connections with the rehabs and skilled nursing homes. So those organizations, people, professionals, they appreciate being able to refer to their pharmacy for their home care too. So you're really in a position, if pharmacy owners would just, if they haven't already changed their mindset, but change that mindset to understand that you could do so much. You are in a position, even more so than a physician in a physician's office, to touch so many lives. You know, you can be the hub of helping your community to stay in their homes, stay healthier, whether that's through, you know, your home care, the medication management that you could do with the home care advocacy that you can do with Happier at Home. All of those things really allow you to be that most important one-stop shop for your community, and also for those professionals as well. So I guess I wonder what you think the one right now, whether it's having to do with business or whatever you think, but what is the one biggest thing that you hear from other pharmacy owners is their biggest challenge? Is there any one big thing that you could say?
Well, I think right now the biggest, red herring is cash flow. Because we have this DIR fee apocalypse coming, you can't wait to address that in January, because you got to start building up additional cash reserves right now. So for me, I'm all about talking with pharmacy owners on ways to increase their cash now. And it's not cash to spend, it's cash to save so that you survive through 2024, because different pharmacies are going to be hit differently. It obviously depends on your Medicare mix, depends on your PSAO and your contracts and things like that. But right now, cash flow is what's weighing heavily for most pharmacy owners. That's what puts most pharmacies out of business. It's not a lack of profit. Although many pharmacies could do better in the profit area, it's the lack of cash flow. You can live for a long time without food and water. You can't live a long time without oxygen. And cash is the oxygen to the business. Because if you can't pay your wholesaler bill and you can't pay your payroll, you miss one of those, you're basically done. And so I think cash flow is the number one thing right now that most pharmacy owners are worried about. We actually held, I've been talking cash flow every chance I get. We held a free cash flow challenge last month. We had over 200 pharmacies join that and stick with us for 5 days to kind of go through that of like how to improve your cash flow. So there's a lot of things that pharmacy owners can be doing. I think it's adding revenue streams. It's, understanding some financial stuff, it's like getting down in the dirty and the numbers, you got to understand some of the financial stuff. But yeah, I definitely think that for right now, and that probably will be the main focus until we hit May or June of next year. So we're down to like 12 months, like cash flow is going to probably be the major thing. After that, if somebody is sitting really good in cash flow wise, I think it's the compliance things happening in November. The Drug Supply Chain Act, that is freaking crazy. It's nuts. Not even the experts really know what's going down on it right now. Like a lot of that stuff's going to be figured out at the last minute. You've got enforcement of hazardous drugs. You've got enforcement of some DEA rules. There's just a lot of things happening in November from a compliance regulatory standpoint that is going to keep some pharmacy owners awake at night.
If I was a pharmacy owner, I'd be afraid not to be a member of your organization. That's what I'm thinking.
I don't know how they do it. Just saying no.
Yeah, no, I know. Seriously. Well, I have to mention that I'm very excited to be part of your Pharmacy Profit Summit coming up in August. So I think Todd wanted to say something about that as well.
Yes. I'm proud that I was there at the first physical one and celebrated being part of something that I saw that was not only necessary, but it was really meaningful. And Lisa, you've always been meaningful. And I think it goes back to the way that you thought when you wanted to be an engineer. Engineer is all based on designing something that can be proven in order to sustain something else and as a support. So you've built yourself literally from an engineering's mind to engineer something that pharmacy can feel assured about. And then you can rinse and repeat and keep growing and keep adding and keep putting something next on. And I think that your methodical growth of your membership shows that the strength of the product and of the services that you're vetting for your members, it makes sense. And you don't keep all the marbles to yourself either. You are extremely like, hey, what there are other organizations that are now sprouting and building their own businesses based on the Pharmacy Profit Summit Live and the centrifuge, this thing that you've built. And there's some interesting things coming in this one in August 4th and 5th in Dallas. We get to be a part of it. We're excited about our vendor initiatives to really get vendors communicating with each other better, to be better support organizations for the survival of, and if community pharmacies thrive and survive, then Debbie's business blossoms, as well as Hugo's business and Liberty Software and RX Value, and we all take advantage of the rise of the next gen community pharmacy owner, and not the one that we left in the 90s, which was wonderful at the time. But we all know on this conference, on this podcast today, and even our listeners know, things have to evolve and things have to change. And the markets are screaming for community pharmacy and senior care help. CNN Health just did a massive article, and it said the cost of senior care is rising while caregivers are drowning without help. They are literally, nursing homes are drowning. They can't find nurses. They can't find nursing assistants. They can't find people. So this is not a service that is, maybe it's a cool service to add on to your community pharmacy. Your community is probably searching for these services right now, which I think is in
it for the fight.
For the fight, exactly.
Yep.
So I'm excited about the Pharmacy Profit Summit Live too. So if you're listening right now and you've never been to a Pharmacy Profit Summit Live, you own a pharmacy, you will not regret going to this and soaking in the innovators of community pharmacy and networking together.
Yeah, we tried really hard to make our summit, which is actually why we called it a summit and not a pharmacy conference. To me, pharmacy conference, I just immediately think like lectures and boring. And so we needed to come up with something different. And so that's why we called it a summit, is because it's a gathering of, it's basically like an extra large mastermind. And, I love to have fun. I love to have high energy, and we bring in amazing speakers. Like every time I go back through and look at some of our old speakers, I can't believe some of the speakers we've all had on our stage. And then upcoming this one in August, we've got Tom Wheelwright, who isn't known in pharmacy per se, but he is like the go-to tax guru guy for small business owners. Tom has personally saved me, probably since I first met him and learned from him, probably hundreds of thousands of dollars of taxes I have not paid, because I learned like the things that were eligible to me. And so pharmacy owners, one of the best ways to improve your profitability, improve your cash flow, is to pay less in taxes. And so Tom's session is going to help with that. We've got Mike Payton from the Entrepreneurs EOS system, the Entrepreneurs Operating System, which is all the rocket fuel and all of those books and that kind of ecosystem of like how to create a system. Most pharmacy owners are drowning from all the fires in their pharmacies, and they're not able to get crap done because they're just trying to keep the lights on and tread water. And so one of the things that I think most pharmacy owners need is a system. And so Mike Payton's coming. He's going to do an amazing workshop on creating that entrepreneur's operating system. And I think pharmacy owners are going to leave there with like, wow, like I now know like steps forward of like how to create this. Some of our other featured speakers, we got Sean Knight, which a lot of people don't know him, but he is a medical clinic specialist. Semaglutide is like the hottest thing on the planet. A lot of pharmacies are trying to understand how they can get on it, how they can get on it legally. What are the ways that they can provide this to their patients? And so we're bringing that in, and he's bringing in his entire ecosystem. So the doctors, the clinics, the legality, the pharmacies, everything in there, which that is, I think, a huge opportunity for pharmacies, because again, you already have those patients. Now it's about layering on something else that they want. And of course, this is cash-based opportunity, which solves that problem of trying to get away from the PBMs. And then one of our other featured speakers is Kyle McCormick, who has been shaking up the industry. Mark Cuban always gets the credit for like cost plus, but frankly, independent pharmacy owners have been doing it for years, long before Mark Cuban ever came along. I know one of my good friends in my hometown did a cash only pharmacy. Kyle has Blueberry Pharmacy. So many pharmacy owners want to understand like how to get into the cash business, but they just don't know how. And I know I'm one of those weird ones where I love figuring out problems. Most pharmacy owners don't. They just like tell me the steps and I'll go do them. So Kyle's going to be telling the steps so people can go do it in terms of creating that cash-based prescription revenue. And then lastly, the really cool thing that we're doing different this year, we're always there to support our exhibitors. We're doing some special things for our exhibitors, but the really special thing that we're doing is we're having 2 stages. So we have a stage that is geared towards that pharmacy owner, pharmacy manager, and then we have a second stage that is geared towards that technician, that staff, admin, marketing. And so we've partnered up with NPTA, Mike Johnston from NPTA, who is a technician savant. He's actually a pharmacy technician who used to own a pharmacy. So that's a beautiful magic of he understands all the pharmacy ownership things and he understands all the pharmacy tech things. So we are creating and curating special content just for technicians and staff. So we'll have 2 stages. And I think that's really important because a lot of times what I do here after people leave the summit is like, oh, I've got all this stuff and now I got to go teach it up to my staff because I didn't bring my staff. I didn't know it was going to be so good and I didn't bring them, and like there's that kind of lag and gap there. And so, bring your staff. We're going to be teaching them the things that they need to know, like in terms of compliance, Supply Chain Act. Okay, you as a pharmacy owner need to know certain things, but guess what? Your technicians need to learn other things. They need to learn what are other steps. How do I check in an order? What do I do if something is not right? How do I quarantine a product? They need to learn those steps that maybe is not the same thing that the pharmacy owner needs to learn. And so we're going to be really focusing on developing that team because pharmacy owners cannot be successful if they don't have a successful team behind them. And so it's definitely going to be a same high energy, same, outcomes in terms of that, same support. One of the cool things that we do at our show that I don't know anybody else in the industry that does, but we provide support to all attendees. So obviously our members get support. But if you're just an attendee, we have a couple of group coaching calls that happen after the summit. Everybody gets a one-on-one call with one of our coaches to specifically talk about their pharmacy. I don't know anybody else that provides that kind of service after a show because I'm a big believer in learning. And to me, learning is not knowledge. Learning is action. And you can have all the knowledge in your brain. If you don't take action, you may as well not know that knowledge. And so to me, when you learn something new, how you show you learn something new is you change your behavior and you take action. And so we're really big on doing support after the summit as well, rather than just cramming a bunch of information at pharmacy owners and saying, all right, good luck, go forth and figure that out on your own. And so
you're really vested in their success. That's why you're very vested in their success. So I'm looking forward to it. I'm going to be there with Happier at Home as one of the vendors. I'm really looking forward to that. And I did some great networking last year. And whenever I could get away from my booth, I was listening to your presenters. And I plan on doing that again this year, especially given the incredible information they're going to provide that I could use in my own business as well. So I look forward to that. And I have a very serious question before we end. So you have something behind you, and I need to know if it's a femur.
Oh, yes, it is a femur.
Is that a femur?
It is a cow femur bone. That was when we rushed. So I'm a member of Phi Delta Chi, which is a pharmacy fraternity. And I don't know if all branches of Phi Delta Chi did it, but ours did that. Whenever you're rushing, you have to carry around this femur bone with you, and it has your rush class and all this information on it. And so it is a cow femur bone.
I have to say, see, my information, my anatomy from way back still is transferable, even with bovine.
You did amazing. Yes.
But that's pretty cool. And if anyone wants to see it, we do have where this is, yes, an Audible podcast, but we post these videos on our YouTube channel also with Happier at Home. So you could listen to it, you could watch it, see any of our presenters. And I want to thank you for being with us today. There's so much to talk about and so much to learn from you. Todd, I wanted to see if you wanted to wrap it up, see if there's anything you had with the last word as well.
I just want to encourage, like I said, pharmacy owners, if you haven't experienced the Pharmacy Profit Summit Live, if you can, it's a get back to school kind of time. It's right before I think most of the kids throughout the nation go back to school. So it's the last ability to prepare for what's happening in November, obviously, DIRF apocalypse, and just preparing and shoring up our foundation and being together. I think I know there's going to be a lot of owners there who have experienced the Profit Summit live before, and it's that networking. And I met you, Debbie, at an event that we were celebrating community pharmacy, and it's why you're part of this network. And we're building this camaraderie with these people who truly, I come to work every day knowing that I want to get the word out for pharmacists and pharmacy ownership and specialty and disease state. And I believe in what you're doing, Lisa. I believe in you, Debbie. You're already proving the ROI on the business model, Happier at Home. I like being a small part of it. I'm going to see everybody there. So get ready to have an amazing event. It's going to be a party. It's going to be an educational party, really, is what it is.
Yeah. Party, main word.
Yeah, no boring lectures. We do workshops. I mean, you'll be working, but yes, it will be fun. We infuse lots of fun.
Awesome. I thank you both. Debbie, this is another great episode of Happier at Home PRN. Thank you so much for putting this together.
Agreed. Thank you. Thanks, Lisa. We'll see you soon.
Thank you.